Welcome and thanks for joining us. My guest today is Kevin Moss, the Director of Marketing and Fundraising at Consumers Checkbook, and also an expert on all things connected with federal benefits and the Federal Employee Health Benefits Plan. And let's get right into the topic of 2025 pricing. The initial news was, yes, everything is up a double-digit percentage across board, but that's where the subtleties really begin. So give us your assessment on what's going on this year.
Much higher prices, Tom. 13.5%, the average enrollee share of premium. Much higher than we've seen. I think we have to go back almost 2 decades to see a premium increase this high. Last year I think it was right around like 8%. The year before, right around 8%. Even 3 years ago it was like 3.8% or so. So much higher, but it doesn't mean all plans move in the same direction. There's about like 26 plans next year where the premium's actually going down, 5 or 6 plans where the premium's staying the same, 69 plans below that 13.5% average, but then there's around 42 plans above that average. So the plan that you're in could have moved in any direction. Yes, the trend is going up, and also what we know in terms of market share, Blue Cross Blue Shield has something like 2/3 of all federal employees and annuitants who are in a Blue Cross plan. Both Blue Cross Standard and Blue Cross Basic are above that average. So majority of federal employees are going to be paying much higher premiums, and you'll just need to check to see how your plan has changed. There's a plan in New Mexico, Presbyterian Health Standard. It went down 22%. That's going to save you about around $720 next year if you're in that plan. Care First has a Blue Value Plus plan in the DC area. Premium's the same. And there's a Health Alliance HMO standard plan in the Midwest. Went up 66%. That's $2,200 more for a self-only enrollee. This is something that you have to pay attention to. It's a for sure expense. In almost all cases, it's changed. And this is the year. If ever there was a year for you to do your homework to see how the premiums are changing, this is the year for you to really lock in and make sure that you know how your plan is changing in terms of premium.
And a detail question and then a bigger question. The one that's up 66%, I mean, should people take that as a signal we don't really want the federal business anymore, even though we're on the plans?
I mean, I think, well, it depends from what position you're in. If you're the carrier and you have enrollees who are willing to pay that high premium, you'll probably take them. But if you're in that plan, I would ask, is there something in that plan that you can't get from any other plan? I don't know that answer. But I would think that the answer is probably no in most cases, and that there are other plans that are available to you that could give you some significant savings in premium, where you probably are able to keep the same doctor, and your out-of-pocket costs may be at the same or even less.
Sure. And my bigger question, I think you've kind of answered when you name the ones that were up and down and so forth across the country. There's no geographical component to whether something's higher or lower. It's just random, it sounds like.
Well, I don't know about random. I think that there's a lot that goes into it. Obviously, the composition of who is in that plan plays a role in terms of how high the premium is. But yes, in terms of how plans are operating in a particular market, you're going to find some plans have had very little change in terms of premium, while others are in that double digit, and some may even be much higher than that.
All right, so then what are your best pieces of advice for shopping for a plan? Because even though the prices are changing, the mix of what they offer probably also is changing. So you've got a lot of things to align to be able to make a cogent choice.
Yeah, what I like to say is that premium is only like one piece of the full puzzle. The thing that I think is as important or more important is the total cost in a plan. So it's the premium plus what you're going to have to pay out of pocket. One example of why you need to pay attention to both of this is that Blue Cross Basic plan. The premium is going up over 15%, something like 15.8% for self and family enrollment. And member cost share is going up. The catastrophic out-of-pocket is rising. The inpatient and outpatient hospital copays are going up. The specialist copays are going up. Brand name drugs and specialist drugs are going up in that plan. You want to know both the premium and any of those benefit changes. The best place to go, Section 2 of the official plan brochure. This is the section where the plan will say, this is how the plan is changing for 2025. And in that section, they will name every significant change that's happening. They will tell you if a benefit copay or a coinsurance amount is increasing. They will tell you if there's a new benefit that's never been offered. They will tell you if there's a new pre-authorization requirement for a benefit. They will tell you everything that's significantly changing. Even if you are happy with your current plan, you think that you probably won't switch plans. The plan you have now is not the plan you're getting in 2025. In most cases, the premium is going up, and in many cases, there are benefit changes. Some are not that important, but some could be really important for you, and the only way you know that is if you're going to the plan brochure and doing some research.
Yeah, and that total cost idea, I think, is really crucial. It's probably, I would think, wise to think about what services you might actually be needing in the coming year. Or maybe you want to do something now because the copay is going to be lower rather than wait till next year if it's more convenient but have a higher copay. And so is the copay like the biggest life cycle cost element after the premium?
Well, yeah, the combination of all that based upon how your utilization is in that plan for sure. And, you may have not a lot of out-of-pocket costs. You're relatively healthy. Maybe, you're going and getting your preventative care, check in with your doctor. Maybe you get sick once or twice a year. You may go to your doctor, or you may go to urgent care. And maybe you have a couple of other things. In low-cost scenarios like that, I think a lot of folks should really be looking at a high-deductible health plan. High deductible health plans generally have lower premiums than some of the popular PPO plans. A portion of that premium gets contributed to what's called a health savings account. And you can use that money in the health savings account to pay for any out-of-pocket healthcare expenses you incur. If you are that healthy person that doesn't have a lot of healthcare needs, maybe you're a younger federal employee, the high deductible health plan with the health savings account probably is the right plan for you. Because of that premium contribution into the HSA that can grow over time if you don't use all of it. And you also have the choice to invest those funds if you want. If you could stack together 5, 10, 15 years, you could have a quite sizable health savings account to draw from for any qualified healthcare expenses.
Interesting, yeah. So you really have to look at all those total costs. And again, Section 2, that's of the OPM guidance.
That's the FEHB plan brochure. So these are all formalized documents. They're all in the same format, regardless of plan. Every plan has a Section 2. That's how this plan will change for plan year 2025. That's the place to go.
And you mentioned the health savings accounts that are available under high deductible plans. For everybody else, there are the flexible spending accounts, different mechanism. But what can we expect there? And how does that figure into the planning for the year ahead?
Got to do it if you're an active federal employee, Tom. Have to say, right? If you don't have a flexible spending account, and by the way, about 80% of all active federal employees don't have one, choosing to use the flexible spending account next year may be enough to offset your higher premium. Why is that? Well, you can, if you enroll into the FSA Feds program, make pre-tax contributions into that flexible spending account, and anything that you pay for qualified health care expenses out of that flexible spending account, you're going to save somewhere around 30%. You're right. There are differences in terms of how the flexible spending accounts work. There are limits, lower limits in terms of what you can contribute, $3,200 a year. And the other thing that people won't like about it, there is this use or lose aspect with the funds that you can contribute into the FSA. You can only roll over $640 into the next plan year if you don't use everything. So you definitely have to do a little bit of budgeting. You don't want to put too much money in there if you don't think that you're going to use it. But if you've never done it before, a no-risk way to get started is just do the $500 or $600. You won't lose any of it. As long as you stay enrolled in the FSA program, it will just roll over to the next year. But I think almost all active federal employees are going to have some out-of-pocket health care expenses. When we think about dental care, when we think about vision care, when we think about the fact that we'll probably get sick at some point and we might need to go to the urgent care, or we are going to have a sick visit, you're probably going to have some predictable out-of-pocket healthcare expenses that you can use the FSA for to pay for. You're going to save 30%. I think all active federal employees can have it. This is something that's only available for active employees. Once you're an annuitant and on Medicare, you cannot participate in the FSA program.
Right, and we'll get to that question in a few minutes, but with respect to those out-of-pocket expenses, can that include copays?
Yes.
You can use your flexible spending account for copays?
Yes.
Okay.
Yeah, absolutely.
Because and you mentioned dental, I mean, dental and some vision care services are very expensive.
Yep.
And so even a copay could be a good chunk of dough.
Well, think if you have to provide orthodontic coverage to a child, you're talking about thousands of dollars. You're probably a max out FSA candidate if you're looking at that. You wish that $3,200 might be $5,200. It's not, but right. And so depending upon what you expect, and that's the key, it's what you expect next year. Do a little planning, do a little budgeting. FSA feds, they had a little bit of a fraud issue this past year around June, and they actually closed the program for new accounts for a couple of months, but that opened back up in August. They put some new anti-fraud and security protections into the program, so it's open now and you can use it. And yes, there's some administration, yes, there's a little bit of friction, but it's even easier if you haven't looked at it. Like, I'm old enough where I had to photocopy a receipt and take the claim form and handwrite it and then fax that into the FSA company in order to get reimbursed. But now in FSA feds, they have paperless reimbursement where you don't even really have to fill out a claim form. And then they have something called pick and process, where in your account, all of your eligible expenses come up and you can decide which ones that you want to get reimbursed for. So it's never been easier to use the FSA, and really, I'll say it again, I think it's the one sort of tool that you have to combat these higher premium prices, because you may not have some of these lower cost health plans available to you. You're going to be paying higher premiums. There's no way to get around that, but you can save on your out-of-pocket healthcare costs using the FSA.
And you can sell your fax machine, and that could help you with copays.
I'm not sure there's a lot of folks who want to buy a fax machine these days, Tom.
Right. Well, maybe a $10 copay.
Yeah.
All right. And a lot of the plans have been making, a lot of hay about their, maybe you could call them boutique types of services or specialized services. And one of the big trends in the last couple of years has been the introduction of infertility treatment plans. And here, again, often these sound really good, but IVF and these different infertility treatments, like dental, they're expensive.
Yeah.
And this might be only a drop in the bucket that you would need as a family. Talk about what you're seeing in that end of things for the plans.
All right, so we'll take a small little journey. So before this year, IVF was not covered by many plans. There was a patchwork of coverage around the country, and it depended upon what state the health plan was operating in. So for example, Hawaii, they had passed legislation where health plans that operate in that state must provide IVF coverage. So FEHB carriers like HMSA and Kaiser that operate in Hawaii typically would cover IVF. This year for 2024, OPM mandated that all FEHB plans must cover artificial insemination procedures and fertility drugs related to IVF up to 3 cycles. And that's a portion of the cost, but there's still a huge bucket of costs, the majority of costs that wasn't being covered. There was one plan this year, one national PPO plan, Blue Cross Standard, which offered a nationwide IVF benefit, $25,000 a year towards IVF. The fertility drugs don't count towards that $25,000 benefit, but there is still a member cost share. And these IVF procedures cost, for one cycle, anywhere from like $10,000 to $25,000. So if you have to pay 15 or 20% co-insurance, even when IVF is covered, there's still significant thousands of dollars of out-of-pocket expenses. So what's changing for next year? Next year, there's another nationwide PPO plan that's offering the same $25,000 per year IVF benefit. That's GEHA high. So everyone will have now a second choice. If you need IVF coverage, you should be looking at Blue Cross Standard and GEHA High. Those are the two plans that are nationwide, available to everyone. Make sure you're looking at Provider Network to see if your provider would be covered in both plans. Also, you want to look at the premium. Blue Cross Standard is one of the highest premium PPO plans. There's a little bit of premium value with GEHA High, but then also out of pocket, your out of pocket is probably going to be a little bit higher in GEHA High because the coinsurance is a little bit higher with that plan. Then, depending upon where you live in the country, there are additional local HMOs that have started offering IVF coverage. So in the DC area, we have Centaura Health in Northern Virginia. We have Care First plans. We have MDIPA. In Colorado, Kaiser plans. In New York, Independent Health. And there's two new FEHB plans, Sharp Health and Western Health Advantage, that are offering IVF. If you're thinking about IVF, you have to, it's what's available depends upon where you live in the country. For these other HMO plans, they may have either smaller annual limits. In some cases, there may be a lifetime limit. There may be a higher coinsurance. Some of those local HMO plans may charge 50% coinsurance, where you have to pay half the cost out of pocket. Sharp Health and Western Health don't allow infertility charges to go towards the catastrophic out-of-pocket maximum. So you have to kind of look at the full benefit picture if you're thinking about this. And also, if you need IVF, max out that FSA, okay, because you're probably going to be needing all $3,200 to help with those out-of-pocket healthcare expenses.
And I guess the worry for people is whether the availability of these services, at least partial coverage, would fuel price increases from the industry providing it, knowing that people have this $25,000 subsidy, if you will, lack of a better word.
I think that some of these expanded benefits could be contributing to the higher premiums that we're seeing in the FEHB program.
And for just on those infertility treatments, is there any requirement or restriction on marital status or who you're married to, that type of thing?
No, there isn't. There may be some pre-authorization that's required, so you're going to want to go to the family planning section. This is section 5A of the official FEHB plan brochure. Learn all that's there. And you may also want to contact the plan directly so that they can help you with understanding how the benefit works.
And this idea leads to the bigger idea that you were talking about earlier, and that is you need to really to approach this in a systematic way, to do an inventory of what, not only of what is in your plans, of your potential plans, but an inventory of what's in your life that you can reasonably anticipate for a year ahead. IVF, that's just one thing, but there's many, many things.
Yeah, I think I was thinking about this earlier today. I think it's a journey, and I think that, I don't know if all federal employees look at it this way, but it seems like it's a journey and it goes through different life stages. And I think in many cases, there's not one FEHB plan that's going to work the best for you in every stage of your career as a federal employee. Like when you start, maybe it makes sense to have a high deductible health plan because you're relatively young, you're healthy, you're not married, you don't have children, and you can build up a health savings account. Then maybe when you get married and you have children, you're looking for a plan that has great maternity benefits. And if you need fertility coverage, you're looking for a plan that helps you with that. And then as you continue on, then maybe you're looking at which plans are best if I'm approaching retirement. And then the plan that's going to work best in retirement is probably very different than the plan that I had when I was 30 years old. And that's the brilliance, by the way, Tom, of the FEHB program, is that every year you get this chance to make a different decision and take that inventory of your life and what you need and find the plan that's going to be the best fit for you.
And by the way, do any of the plans offer like premiums or incentives of any kind to stick with us for another year, like frequent flyer points or something?
You don't get those, but you do get wellness benefits. So, they want to incentivize that you're doing all the little things to keep yourself healthy. And just simple things like making sure that you take your annual physical, or making sure that you're getting the flu vaccine. These types of things, they're health plans that provide financial incentives paid through kind of like prepaid FSA cards that you can use for out-of-pocket healthcare expenses. You'll find plans that offer free or discounted gym memberships, smoking cessation. Plans are starting to incentivize health versus just treating people when they're sick. They understand that, that's more cost effective and it's better for the members themselves, of course.
Any other benefits? We talked about infertility treatments. What about maternity, mental health? Those are other areas that seem to be a growth in offerings.
Yeah, I think that on maternity, there's always been and it continues to be coverage for postpartum depression. But next year, we're going to see more plans offering coverage for things like doulas, midwives, delivery at birthing centers, nurse home visits. Almost like half to 2/3 of all FEHB plans will start offering just additional maternity benefits. And then on mental health, it's really like mental health parity and paying for mental health benefits at the same way that you're paying for physical health benefits.
All right, so that's again something to bake into that inventory that you're looking at for your own personal life or your family's life as you look ahead toward 2025.
Yep.
And do we know the numbers of carriers, the rosters? I think in the prior year there was a significant drop in the number of carriers.
This year we have lost a couple of plans. So in New York, CDPHP, and then Tom, you're going to love the name of this plan. It was called Health Insurance Plan of New York, or HIP.
HIPNY.
It was HIPNY. HIPNY is out. Blue Shield HMO Plus, which was an HMO plan in California, dropped. Dean Healthcare in Wisconsin. Those are the plans that dropped out of FEHB. The other thing that may happen is you might have a service area change where certain service areas that used to be part of plans no longer available, so you'll want to check on that. Those were the big changes in terms of available plans. On the other side are new plans. And so one that I want to highlight, which is a new plan for a lot of folks because traditionally the plan was restricted to working at a particular agency, either the VA or State Department or an intelligence agency, was Compass Rose. So Compass Rose in FEHB has opened up enrollment to everyone in FEHB. So this is a new plan that many people will have access to that maybe they haven't considered before. So Compass Rose will be a new plan in 2025 for many. And then we talked about them for IVF, but there's two new plans in California, Sharp Health Plan in the San Diego area, and then Western Health Advantage. They're in Northern California outside of the San Francisco area.
Okay, and let's talk about retirees. They have issues of their own. Part D and the incorporation of that into various plans. What should people expect and look for?
I think there's going to be maybe a few new FEHB plans that are offering Part D plans, but still kind of the same number of FEHB plans that are offering Part D. The big thing with Part D for 2025 is now all Part D plans have a $2,000 out-of-pocket limit in terms of your out-of-pocket prescription drug expenses. So this is new. It's new for 2025. So any federal annuitants that have significant prescription drug costs, Part D could be a huge way to save money next year. How it works is the plans that offer a Part D plan, if your plan offered it this year, which 17 FEHB plans did, and you opted out, then you will have to proactively opt in this year if you want it. But if that's not you, then you'll be
You would have opted out because you would have gotten it directly through Medicare?
No. So there is an ability within FEHB to either accept Part D or to opt out of Part D. And some annuitants last year, since it was the first year and maybe they didn't understand it, chose to opt out. Once you make that choice, most carriers aren't going to opt you in the following year because you opted out this year. So if that is something that you're interested in, you will have to make a proactive choice in open season in order to opt in. But if you didn't do anything last year and you're a Medicare enrollee and you have Parts A, and either Parts A or Parts A and B, you're auto-enrolled in the Part D plan. Your carrier will notify you that you've been auto-enrolled in Part D, and during open season, you have a choice. You can either take Part D, or you can you can opt out, and then you get your FEHB prescription drug coverage. Now, in order for
you opt out of Part D through Medicare or through your insurer?
Through the insurer.
Through the insurer.
Through the
Okay.
insurer. With Part D, in order to get OPM approval, the Part D plan has to offer equal or better coverage. What that means is that there has to be the same drugs that you had access to from the FEHB plan must be on that Part D formulary, and the member cost share at least has to be as good. Like worst case, if it was $20 on your FEHB plan, I'm going to have to pay $20 on Part D. But in many cases, you could actually see prices lower in your Part D plan. That, in combination with the $2,000 out of pocket, I think for most federal annuitants, this will be something that they will want to keep next year. There's one other interesting fact about Part D plans with FEHB that's not true of the commercial Part D market, and that is OPM requires all FEHB plans to cover at least one GLP-1 weight loss drug prescribed for weight loss. Now, this is something that Medicare Part D plans don't cover if prescribed for weight loss. Commercial Part D plans do cover some of these GLP-1s, but you have to have, they must be treated for things like heart disease or diabetes, not for weight loss. But in the FEHB program, GLP-1s are prescribed for weight loss. That requirement extends to the Part D plan. And so you still have access to your GLP-1 weight loss drug if that's something that you need, something that commercial Part D can't offer.
Right. So then Part D, you really have to think about the source of Part D, whether it's the government's Part D through Medicare or through your plan. And OPM has a lot to say about what the Part D in the plans, in the FEHB plans, have to offer.
Yeah, and I think that there's more requirements in terms of drugs that must be covered from FEHB to carriers that are offering Part D than what you're going to find in the commercial Part D space. And the GLP-1 example is a good example of that.
All right, discuss Part B. That's the other big question that always comes up every year.
To be or not to be, Tom?
Right, something like that.
What are we going to do with Part B? So yeah, there's an extra premium that you have to pay, for Part B. And a lot of people have questions about, well, why pay this extra premium? I already have my FEHB coverage from retirement. I worked hard for that. Why take Part B? The reason to think about taking Part B is because it could potentially reduce your out-of-pocket costs. So many FEHB plans coordinate their benefits when you have Medicare. So your copays for doctors, your copay for outpatient services, if the plan has a deductible, those will be waived from some plans when you have Part B. There's a handful of FEHB plans that also give you part of the Part B premium back. It's called Part B premium reimbursement. Blue Cross Basic, GEHA High, those are two national plans that do that. And so, yes, you're paying this extra premium, but you're seeing reduced out-of-pocket costs. And these are one of the reasons why you should consider Part B. Another is that you can use Part B to go outside of your plan network to see any doctor that accepts Medicare. So, for example, if you were in, let's say, Blue Cross Basic doesn't have out-of-network provider coverage. But if you were in that plan and you enrolled in Part B, you can now take Part B and go to any doctor that's outside of your network. So these are two of the main reasons, and the third main reason is that with Part B, you're then eligible to consider Medicare Advantage plans, which I'm sure we'll also talk about. But Medicare Advantage plans are the lowest cost plan option for many federal annuitants. And one of the requirements of being able to enroll in a Medicare Advantage plan is that you must have Part B.
Okay, good, yes. And so a lot of people worry about the Part B premium, which is based on income. And if you're freshly retired, they're looking back at, say, if you were a senior executive and maybe your spouse, and that's not unknown, was also a senior executive, you got this holy cow premium. But if you are in a new income bracket, you can argue that through Social Security, I think, to Medicare.
Yep, there's a 2-year look back. But if you expect lower income, then and what you're talking about is IRMA, income-related monthly adjustment amounts.
As always, you said it better than I did. Yes, IRMA.
That's correct. But yeah, what you pay for Part B, there's the standard premium, and then they look at your income, and depending upon your income level, you may have to pay this extra IRMA surcharge. But there's a 2-year look back, but once you're past those 2 years, that in and of itself isn't necessarily a reason to not take Part B. One, because it could go away, your income could drop in retirement, and then also you can go to the Social Security Administration and you can tell them that our income isn't as high as when we were working, and you can try to ask for that IRMA to be taken away or dropped.
Sure, okay. And let's talk about Medicare Advantage plans now, because that's where a lot of annuitants find complications.
Yeah, Medicare Advantage plans. So they've been around for a few years. There's about the same number of options this year as in previous years. I always highlight a few because they work in particular ways that really lower costs. So Aetna Advantage is one that we talk about because it's available nationwide. GEHA, in both their high and standard, have a United Healthcare Medicare Advantage plan. And then if you live in one of the United Healthcare markets, Washington, D.C. area is one, but they cover about half of the U.S. All three of those plan options do the following to help reduce costs. One, they have generous Part B premium reimbursement. The United Healthcare options, that's up to $150 a month, which very little Part B premium on top of that $150 premium reimbursement that you would be obligated for.
Yeah, that drops it to about $25 or something.
Yeah, and then they also are zeroing out all out-of-pocket healthcare expenses except for prescription drugs. So what you pay to the doctor, hospital, acupuncture, chiropractor, and all three of those plans, it's $0 out of pocket. You still may have some out-of-pocket expenses for things like dental or vision or hearing aids, but all of your major medical is going to be zero except for prescription drugs. And the prescription drug copays tend to be a little bit lower than what you're going to see from FEHB plans. And all of those plans have Medicare Part D baked in. So you're also getting that $2,000 out-of-pocket prescription drug limit protection next year for plan year 2025. When we at Checkbook model these plans against a lot of the other popular plans that retirees enroll in, we see thousands of dollars of savings in these plans. The savings are really significant, and I think all annuitants really need to look at these options and just kick the tires a little bit to see if one of them might work. One thing that I didn't talk about that I want to highlight is a lot of them offer extra benefits that your current FEHB plans isn't offering. Anywhere from $30 to $50 every quarter for over-the-counter expenses. For pharmacy items, things like silver sneakers, which is like a gym membership program for seniors. There could be other dental and vision benefits. So really need to take a look at Medicare Advantage plans to see if they might work for you.
And that would be in place of a standard FEHBP plan for annuitant.
Yeah, I wanted to say it's a little more nuanced than that. You actually stay enrolled in FEHB. So it's like a 2-step enrollment process if you want to join one of these plans. So let's take Aetna Advantage, for example. If you were interested in the Aetna Advantage Medicare Advantage plan, you would enroll in the FEHB Aetna Advantage plan, and then a separate enrollment step that you can either perform online on the Aetna site, or all of the Medicare Advantage plans have a 1-800 number. And once you're enrolled in Aetna Advantage with FEHB, then you enroll in the Medicare Advantage plan. So there is an extra enrollment step that is required in order to get into that Medicare Advantage plan, but you stay enrolled in FEHB.
Got it. Okay. And then we should probably talk about the Postal Service. This is an ever morphing, changing situation over the last couple of years as they come into the OPM, FEHB large complex. What do we know about Postal Service this year? Well,
they've always been in FEHB. What's different is the Postal Service Reform Act was passed that required that some different Medicare integration requirements and in the creation of a new Postal Service health benefits that's underneath the umbrella of FEHB. So plan year 2025 will be the first year for PSHB. And there's a couple things to know about PSHB. First is there's far fewer plans. If you count only the self-only enrollment codes, unique codes, there's 78 PSHB plans, so a little more than half of what's available in FEHB. This will impact, obviously, some postal employees and retirees in terms of their current plan not being in PSHB. But what's true is that Blue Cross has all their plan options in PSHB, GEHA, MHBP, NALC, APWU, these are all national plans that have many postal employees and annuitants. All of those plans have their current offerings in both FEHB and PSHB. So the vast majority of postal employees and annuitants, their current plan that they're in will be a PSHB plan. And year one, you are auto-enrolled into your current plan. So for example, if you have GEHA high right now as a postal employee and annuitant, you're going to be auto-enrolled into GEHA high in PSHB. And when you go into OPM's new central enrollment platform, which is PSHBS, that will be the plan that says this is the plan that you're going to get. It does not mean that that's the plan you have to stick with. You have the option to choose any other available PSHB plan that's available to you, but if you do nothing, you will be auto-enrolled into GEHA high. So that's the case where your current plan exists in PSHB. For the postal employees and annuitants where your plan is no longer available, you also will be auto-enrolled. And the plan that you're auto-enrolled in is the lowest cost nationwide plan that's not a high deductible health plan that doesn't charge a membership fee. And that is Blue Cross Blue Shield FEP Blue Focus. So when that person goes into PSHBS, they will see that they're going to be enrolled in Blue Cross Blue Shield FEP Blue Focus. That may or may not be the plan that they actually want to enroll in. So they can, if they want, change to any other PSHB plan that's available to them. But if they do nothing, that's the plan that they're going to get. Now, the goal here is to make sure that everyone gets a PSHB plan. So even in the case where you do nothing, you will get a plan, you will get covered, but I think that postal employees and annuitants should take agency of this situation and be proactive to make sure that they're getting the plan that they actually want.
Right, so read the brochures. They're actually delivering to the households.
Well, there's still some of that that's going on, but there's online comparison tools that are available to the postal community to help them make this choice.
But the roster of plans that are available to postal employees is a different list than is available to other federal employees.
It's comprised of the same plans that are in FEHB, there's just far fewer. So, there's certain plans, a lot of smaller HMO plans available around the country to all federal employees didn't make it into PSHB. But most of the large nationwide plans are there, and a lot of those large nationwide plans have high market share in the postal audiences. And so the majority of postal employees and annuitants, the current plan they have is going to be a PSHB plan.
And what you said, too, about the HMO availability, probably something we should discuss because it comes up every year, and that is the relative cons and pros and cons of HMO plans versus PPO plans. Because huge cost differences, but also huge benefits and
I think it's part of the larger conversation we had about just the inventory of what your needs are, how often you travel, whether you have a student that goes to college in a different part of the country. HMOs may offer greater value, lower premium. They may have lower out-of-pocket costs. And then you have to compromise potentially that they may not have a nationwide network. And in the case of Kaiser, there's fewer access to facilities or providers. Kaiser, by the way, gets really high marks, though, from its members. Their members tend to really love Kaiser and rate it quite well in terms of satisfaction, but it is a much different model than the larger PPO model in terms of plans.
And you also have to watch the merger and acquisition market because a lot of these companies are looking at merging with other companies, and that could change the premium picture and change the offering picture at some point down the line.
Yeah, I think that's a possibility.
All right, so summarize then for us. what should people be doing now? And really, this is a component not of just your health plan for your life, but also your financial wellness too, really figures in pretty closely.
I love what you just said there, Tom. This is a
no charge.
This is a healthcare decision. It's also a financial decision. It's a complex decision. There's emotion that goes in to this in terms of access to providers, whether I can see the doctors, that I want, and how I'm going to experience the healthcare system. I say every year, I want to see employees being proactive during open season, to actually look to see, am I in the right plan? There's something of only like 5% every year of federal employees and annuitants who switch plans. I think that is too low. I think it should be higher. When I have conversations with a lot of folks, I hear all the time that I keep the same plan that I had. I've been in the same plan for 15 years. That may be a great decision, right? Because that plan is doing everything for you and it's also low cost. But I also think that there's a lot of people that have been in plans for a decade or more where it's probably not the right plan. And, 7% here, 8% here, 13.5% or higher here, there's a cumulative effect of that higher premium. And, you may not notice it just one year, but look at it in 5 years or 10 years to see how that stacks up. And then how is that current plan where does that rank amongst all the other plans? So take an inventory of your healthcare needs. Take an inventory of all of the health plans. 81% of federal employees think total cost should be the number one factor in choosing a health plan. This came out in an OPM federal benefits survey. We agree with that. We think that's the thing that should really be driving a large portion of the decision. It's not everything. You still need to check to see, are your providers going to be in any given health plan? What are the important benefits for you? And will those lower cost health plans still cover you? But using total cost as a way to take 30 or 35 plans you're eligible for, narrow that down to something that's easier for you to actually go further with. Make sure you understand how your plan's premium's changing. Make sure you understand how the benefits are changing. Go to Section 2 and consider whether there's a lower cost health plan that could provide just as good a coverage as you have now, but at a lower cost.
Thanks so much for all of your insight as usual. My guest today has been Kevin Moss. He is the Director of Marketing and Fundraising at the Consumer's Checkbook. I'm Federal Drive host Tom Temin. You're watching Federal News Network. Let's go back to the studio now for more on the open season exchange.